Good morning, everyone. All right, I think we can go ahead and get started. Good morning. So, welcome to this morning's Community Health Grand Rounds, and it is the Maternal Oral Health Exchange, where maternal, pediatric, and oral health care meet. So, I'm Stephanie Kennedy, Senior Program Manager on the Capacity Building team, where I manage LPHI's family health portfolio. And today's Grand Rounds is unique and it's special because it's also doubling as the kickoff for our maternal oral health exchange community of practice. So again, where maternal, pediatric, and oral health care meet. So during today's session, I'll ground us in some national and state-specific data that describes the maternal oral health landscape, and then we'll dive into two exciting fireside chats. First with Dr. Nick Masca, Associate Professor at LSU School of Dentistry, and then with Dr. Victoria Williams, Member, Owner, and Advocacy Lead with the Birthmark Doula Collective. So we will save some time for Q&A, and then we'll provide more information about engagement opportunities regarding this topic. So before we dive into the data, I do want to pose a couple of poll questions to the group. So first poll question, and they should both come up at the same time. But true or false, dental care is generally considered safe during pregnancy. True or false? And then the second question is going to, we want to engage where you are coming into the session. So coming into the session, how aware are you of the connections between oral health and maternal health? So first question, dental care is generally considered safe during pregnancy. And then coming into the session, how aware are you of the connections between oral and maternal health? And we'll maybe take another 10 seconds to answer. And I can't see the results. Anyone else on my team can see how folks are responding?
Yes, I
Yeah.
can. So 85% said true and 17% said false.
Okay.
And then for question two, 16% said not at all aware, 22% said slightly aware, 43% said moderately aware, 18% said very aware, and 0% said extremely aware.
Okay. So it looks
I'm
like
going
we
to
might have
share.
some.
You should be able to see the results now.
Yes, we can see it. Thank you, Mignon. All right. So we might have a little bit of work to do, but I think we'll be able to or touch on some of these topics in our fireside chats today. So our expert speakers are going to dive deeper into this, but what we do know is that there is a link between maternal and oral health. So preventative and routine oral health care, like oral health screenings and teeth cleanings, are essential to maternal health. So improving and or maintaining good oral health reduces the risk of infections that can be linked to cardiovascular disease and ultimately adverse pregnancy outcomes, excuse me. And for children, early oral health is linked to overall physical health outcomes, speech development, and other long-term health outcomes. So if you're not familiar, the Pregnancy Risk Assessment Monitoring System surveys women who deliver a live-born infant within a given calendar year to collect population-based data on maternal attitudes, behaviors, and experiences around the time of pregnancy and childbirth. So the survey gives important insights into improving the well-being and overall health of mothers and babies. And according to CDC's 2023 PRANS data, more than half of all pregnant individuals did not receive a dental exam or cleaning during pregnancy. And in Louisiana, about 72% of pregnant individuals did not access dental care during pregnancy, placing pregnant women at a much higher risk for poor oral and physical outcomes. And we know that most pregnancies in Louisiana are covered by Medicaid. So we included data for our Medicaid and CHIP covered families as well. So from 2018 to 2022, 90% of individuals who reported a live birth did not receive an oral exam. And around 87% of individuals did not receive any documented dental service. So this could be any service, including an extraction, filling, cleaning, etc. And I think it's safe to say that we can, again, do better in Louisiana. And again, our conversation today will touch on some barriers and possible solutions to improve access to oral health care for pregnant people. And we'd also like to touch on some recent Louisiana state policy that's relevant to oral health care and potentially crucial to groups with major health needs, including pregnant people. So there are people in the state who've been denied medical treatment to which they're entitled because they cannot get clearance due to a dental problem. So people with urgent healthcare needs, such as those needing cancer treatment, heart surgery, or other operations, oftentimes don't have dental coverage, leading them to develop dental infections and problems that prevent them from receiving medical clearance to have procedures that they need. So during this past legislative session, House Bill 222, a bill that addresses this problem, was signed into law. So this bill, sponsored by Rep. Stephanie Baralt, helps correct the issue by requiring the state Medicaid program to cover enrollees' dental procedures if they are necessary for a patient to be cleared or for another Medicaid covered medical procedure. So this way, a dental issue does not need to stand in the way of Medicaid enrollees having their health needs addressed with potentially positive impacts to pregnant people in Louisiana with urgent pregnancy or general health care needs. So this is a bright spot in Louisiana. So with that, I'll turn it over to Nick Harling, LPHI's policy coordinator and a coordinator on the Maternal Oral Health Exchange. And then I'll turn it over to Mignon Holton, LPHI's family health coordinator, to introduce and facilitate the chats with our speakers today. So Nick, I'll turn it over to you first.
Yes, thank you so much, Stephanie. Really appreciate it. Thank you for kind of getting us grounded, and I'm really excited to get us started with our speakers today. Like Stephanie said, my name is Nick Harling. Good to see everyone here today, and I'm the program coordinator on LPHI's policy team. And in my role as one of many responsibilities, I have a big role in supporting our organization's state legislative advocacy efforts, especially around policies that advance statewide maternal and child health. So very much. The work that we're doing as part of this project right here is very kind of intertwined with the policy work that we do. And it's also my pleasure to introduce Dr. Nicholas Mosca today, a fellow Nicholas like myself, as our first speaker today. And Dr. Mosca is an associate professor at the LSU School of Dentistry and a longtime public health professional whose expertise is grounded at the intersection of oral health and maternal and child health as well. So Dr. Mosca, thank you very much for joining today. And before we get into some questions, I'd also like to say that having just finished my first full legislative session since joining LPHI on our policy team, it's really wonderful to have a chance to collaborate and speak with a subject matter expert like yourself. So thank you very much for joining us today.
Well, thank
Um,
you. And let me also ask if I could. One of the advantages of Zoom is I'm going to ask everybody for a big smile. Can I see everybody smile for a moment? Okay, awesome. But today we're not going to talk about white teeth and a pretty smile. We're going to talk about what's behind that, which is that oral health is inseparable from overall health, and it's not cosmetic. I mean, we focus our marketing on cosmetics, but the reality is that we're talking about infection and inflammation that occurs in the oral cavity. It's associated during pregnancy with a range of detrimental pregnancy and birth outcomes. I'll go into that in a few moments. But it's also associated with a higher risk of transmitting tooth decay causing bacteria from the caregiver to the child. So those are the risks that we need to address as part of good health care. So let me drill into that. Is it okay, Nick, or should I hold off? And I think you got something else to say, right?
Oh, I mean, I'm really just gonna kind of get into the question, so I'm sure it'll kind of
Sure.
seamlessly transition regardless. But
Okay.
I think I kind of catch the trajectory you're going on. So I guess kind of just to get us started, I'll try to ground us even more. And I just like to ask very point blank, and I have a feeling you're going to touch on this and what is the link between oral health and maternal health, and how can a pregnant mother's oral health affect that of her and the health of her and her child?
Okay, well, so there's pregnancy-related hormonal, dietary, and physiological changes that occur that can increase the risk of infection and inflammation in the oral cavity. So let me start with swollen and bleeding gums. People notice that when they're brushing their teeth, there's blood on the tooth bristles. That we call pregnancy gingivitis. There's a more serious type of condition that's similar to gingivitis that we call periodontitis, also known as periodontal disease. It's just a more serious infection that causes inflammation around the roots of the teeth in the bones, upper bone, lower bone. But this condition is the leading cause of tooth loss. It weakens the anchoring of teeth and it causes them to become loose over time. Tooth decay, which cavities, which I think everyone's aware of, I hope, is associated with changes in maternal diet, increased snacking, for example, dryness of the mouth that can occur, and difficulty maintaining good hygiene. Maybe having other things on their mind and forgetting to brush at least once a day. Tooth decay is the one that we tend to focus on, but there's another condition called tooth erosion, which is a weakening of the enamel of the teeth that is caused by acid. Remember, people can develop morning sickness, so they can develop acid reflux, and that can weaken the teeth and look like a cavity caused by infection. 40% of pregnant women have some form of gum or periodontal disease during the pregnancy. It's associated with preterm birth, low birth weight, and preeclampsia. However, the association does not prove that these conditions are actually causing these outcomes. There's a need for further research. There have been some studies that are supportive. There's also been some studies that haven't proven it. So that's just a consideration. But I could absolutely say with confidence that periodontal disease and other dental conditions, the treatment of those conditions is safe during pregnancy. So I'm glad to see that a majority of the participants feel that way as well. The guidelines that have been released in 2025 have made that clear. I mean, it's even safe to have dental radiographs taken during pregnancy, which is a big reversal of thinking from the way that we treated patients in the past.
Fantastic. Thank you very much for providing that context. It's reassuring to know that it is safe to receive this treatment, and like you, I'm very glad to see a lot of um the people who signed up here taking note of that. I also like to touch on the thing that Stephanie said before we got started with our chat. As she discussed, data suggests that less than half of women in the U.S. and a considerable amount less than half in Louisiana receive a dental exam or some kind of dental cleaning during pregnancy. So I'm curious to ask you, what are some roadblocks that prevent pregnant people from getting the oral care they need?
Well, the Louisiana data reveals a substantial and persistent access gap. 72% of pregnant women statewide have received no dental care during pregnancy, according to that PRAMS study. But the problem is worse for pregnant Medicaid and CHIP enrollees, where about 90% receive no comprehensive or periodic oral examination, and 87% receive no documented dental service. So we have to ask what could be contributing to this. And, the one that seems to be the most likely, but your attendees are much more educated on this, is that there seems to be a misconception that dental treatment should be postponed during pregnancy. And I can say that I have talked to some providers, and it's just a lack of updated knowledge about the revision of the practice guidelines in some situations. But there's also a perception that the liability is still great. That if I was to do care during a pregnancy and then there's a, a poor outcome from the birth, that those are related. And so that's a perception issue, I think. The data shows that care can be provided safely during all trimesters of the pregnancy. So other barriers would include the lack of dental insurance coverage, higher out-of-pocket costs because health insurance doesn't cover dental insurance typically. Families have transportation and childcare needs, and that costs money as well. So there's competition for how they spend their dollars. Difficulty scheduling multiple appointments. If the providers were co-located, it would make it a little bit easier to do sort of a visit where you have a multidisciplinary opportunity to receive services. But that's not necessarily how our healthcare system works. Limited number of dental providers. We've made great progress in Louisiana with enrolling dental providers to provide care for Medicaid beneficiaries, but there's still pockets in the state where there's a lack of Medicaid dental providers. And arguably, I think weak referral relationships. There are some dentists who I know that are associated with hospitals. Dr. Suzanne Fournier, for example, pediatric dentist, works with LCMC, Children's Hospital, very well connected to other providers, medical specialists. But that's not always the case in our cities and towns across the state. And I think all these collectively kind of create a perception that it's just a little bit challenging for people to access care. And then, the economy right now, groceries are up, gasoline prices are up. All that's going to be competing against ability to pay for a dental procedure. You have to decide what you need.
Definitely. No, thank you very much. I think you make such a good point in discussing the fact that the everyday difficulties of the economy right now, that was very resonant with me. I mean, I think I probably put off dental care even in my own daily life, probably a little bit because of the economic, situation. So I appreciate you bringing that to light, as well as all your other points. And then also kind of building off of what you say, you mentioned how oftentimes there's a lack of a referral network, proper relationships between these different care providers. You know, we often say, because patient health needs are very multifaceted, we often talk about the importance of a continuity of care across different providers. You kind of just you just kind of recommended this yourself, but from your perspective, what are the greatest opportunities for improving collaboration between dental, maternal, and pediatric care teams?
Well, every perinatal encounter is an opportunity to identify infection and inflammation in the mouth. It's also an opportunity to correct misinformation that people may be getting off of social media, from the mass media, from friends, colleagues. And it also is an opportunity to connect people with the care they need. So I think that although provider education is important, and we would expect all healthcare professionals to know a little bit about the oral cavity and the diseases that can occur, education alone is not going to create higher quality care. It's a shared responsibility, and it's also a multi-system issue. Um, we must share the care rather than pass the patient on from one silo to another silo. I mean, I'm a cheerleader for oral health care, but I know that it's a separate system. It's rare to have dentists who work within a larger healthcare environment. Um, and so really, medical, dental, behavioral health, we all need to think about how we can improve bidirectional referral, communication protocols, relationships for referral, and have a clear responsibility amongst all providers that we're going to be diligent and do the follow-up. I also highly support a dental team taking blood pressure at every visit by a patient, every single visit. So I'm not just preaching to others. We all share a common need to think about how we approach health in the US. Again, if oral health is inseparable from whole health, we need to approach our patients from that approach. So I'm going to walk through what I think is a practical approach. It's called ARC. All providers need to ask certain questions. I'm going to point to the obstetrics and the perinatal side for the purposes of this discussion. Obstetric and perinatal providers should ask all pregnant women, are you having tooth pain, swollen or bleeding gums, or difficulty eating? It's just a standard question. In the same way that we would do behavioral health screening and ask people if they're depressed. We should ask this particular question. We should also ask if they have a dentist and when their last dental visit is. To me, those two questions would go a long way to help screen people for these problems. And then we need to reassure our patients. So that's the R in ARC. We need to remind them that dental care is safe during pregnancy. You don't have to wait until it blows up. And you have to go to the emergency department with a throbbing abscess that could spread to other systems in your body. But the C in ARC is then we need to connect those people. They don't have a dentist, for example. We should already have lists that we can refer people to, people that we know are treating pregnant patients or who accept Medicaid, for example, and CHIP. We need to make sure that we have that information at hand in all of these care sites. And then we need to close the loop. We need to make sure that the person got the appointment that they needed and ask whether the care was provided. So to me, it's just a dynamic of doing a better job of dismantling silos, connecting our healthcare, and moving forward so that we're avoiding the more expensive problems that require hospitalization or admission. And in this case, more importantly, that could contribute to poor birth outcomes, preterm birth, low birth weight children, and worse.
Fantastic. Yeah, thank you very much for elaborating on that. I think everybody could benefit from hearing that reassurance and that curiosity from their providers, and it seems like a really effective way of doing it. And kind of just building off that, and this would be my last question before I kick it over to our next team. Is really just, first of all, we know, like you said, that regular communication between these different care providers is obviously a very crucial step to achieving this, consistent collaboration. But I'm also thinking, maybe this alone might be hard to achieve given factors that different practitioners face, like, patient volume, time constraints, the everyday demands of their job. So I'm also thinking, more structurally, what healthcare infrastructure changes could be made to support this process of more integrated care for families?
Well, so the individual clinicians, you're absolutely right. Individual clinicians cannot really sustain this need. We need supportive policy, financing, technology training, and we need a stronger referral infrastructure. So let me just elaborate on a couple of points. First of all, closed loop communication. We need to make it possible for people that are trying to refer a person for oral health care or for medical care. We need to make that easier. What would go a long way to improving that is to have interoperable information systems. Dental clinics tend to be standalone with their own health information system that doesn't communicate well with other offices, with medical. I think that there's a great need for us to explore this and to come up with solutions that allow easier referral and make the communication much more accessible and faster. We need coverage and reimbursement. So we have to ensure that there's meaningful dental coverage during pregnancy, throughout pregnancy, and during the postpartum period. We need to pay for oral health screening if a non-dental professional is doing it, and we need to pay for the care that the dental professional is doing as a result of the referral from the non-dental professional. These should align. We need workforce training. I think we could all do a better job of contributing. I think the dental office, I'll speak for our own care system for a moment. I think we need to do a better job of building working relationships with maternal health care providers. We could use our history form, for example, to identify the providers that our patients are seeing and to make an effort to maybe reach out to them and say, hey, we're sharing these patients. So I think maybe we should, come up with a stronger collaborative approach to their care. And more importantly, let's keep the referral pipeline open.
Definitely. Well, thank you so much, Dr. Mosca, for sharing your expertise. That was really informative for me, and I'm sure everybody attending today. With that being said, I'm now going to move us over to our next conversation between Mignon and Dr. Williams. So, Mignon, take us away.
Hi, everyone. Thank you so much for that insightful conversation. I really appreciated the emphasis on dental care being safe during pregnancy and on increasing collaboration with maternal care providers. And I'm excited to continue that conversation with Dr. Victoria Williams. So, I recently completed a project with Dr. Williams on the doula collaboration community of practice. So, this is where we developed the doula gold standard, which is actually a doula friendly designation for hospitals. So, Dr. Williams brings an abundance of expertise. She is a doula and a leader in maternal child health. She serves as advocacy lead and member owner of Birthmark, where she implements community driven programs and policy efforts. She is deeply committed to trauma informed care, maternal health education, and improving outcomes for Black birthing people. And she does so much more. She's involved in so many different things. So, Dr. Williams, thank you so much for being here with us today. And I'm going to get started with the first question. So thinking about what it means to provide whole person care, I'd love to get your perspective. When we talk about integrating behavior, oral, and maternal health, where do you see the biggest barriers today, and how can we address them?
First of all, hello everyone. Thank you so much for having me. I'm so grateful for LPHI and all of our partners in this conversation because I think that it is very personal for me as well, but also I think that it really ties into the maternal health world. And one of the biggest barriers that I see most often is these silos of access and silos of workforce. So being able to have this conversation, with a lot of other players is amazing, and I'm so proud to be here. But once again, thank you for that question. But when we talk about integrating like behavior, oral, or maternal health, I think one of again, Dr. Mosca also spoke to this is like the barriers of access and silos and the workflow. There are often like they're treated. These systems are treated separately, and I think that there are just like different referral patterns, different reimbursement structures. We have different forms of communication channels in each one of those areas. So as you spoke earlier, Dr. Mosca, like if we had a place where one-stop shop, where all these things were prioritized, maybe, there would be um, a greater emphasis on direct, like truly whole person care. And also, when you think about other challenges, is like patients are often navigating multiple needs at once, stress, anxiety. Yeah, oral health. You have concerns about transportation. Then you have insurance barriers. These systems they don't always address or make it easier for our clients. So to address this, we need a stronger coordination. And we talked about this earlier, and I really agree with that. We need warm handouts. But I also say when we have warm handouts, we need warm places to send people, which we often don't have in our state. We also need a shared referral pathway. And so we're looking for workflows that really help providers see the full picture of our patient in real time. And I think that would really help in all areas of health and whole person health care.
Yeah, for sure. I definitely feel like today we've emphasized that these systems are so siloed. It's really hard for patients to navigate them, especially when they're experiencing so many different health needs. So, in your experience, what do you think a seamless care experience could look like for a pregnant patient? And what role can providers, health systems, and payers play in working toward this like goal of having a seamless care experience?
Right. Oh, wow. I mean, I dream about this all the time. Trust me. A seamless care experience means that our patients do not have to piece everything together on their own. It looks like coordinated communication between our providers. It looks like easy referral systems, really timeless follow-ups. And I know if Dr. Gillespie was on this call, she know that I would always say our community health workers in these spaces would really help with this follow-up. It'll also help with creating care plans that really respect the whole person and their entire families and not just their condition at that time. And I think that that's what these silos really focus on. Oh, I'm just going to focus on this one condition when we know that all social determinants of health really affect everything that our patients are going through. And for the patient, it will feel connected. It will really feel clear. They would have, like, the system is not fragmented or confusing. Providers can be supported also by their screenings for the need for early screenings. Like they'll have the tools that they need. We're looking for and making these referrals really warm. So I envision a healthcare system that builds better workflow, that it builds a shared infrastructure of shared information across all what do you call those care teams, um, and really is supported with coverage, right? That's the biggest key: coverage and access. And so when we have all three of these things aligned across all services, I mean, can you see a better way to manage care? Like, do you see how it will help a human really understand how to manage their care, not just inside of a system, but also on their own? And as a doula, that's what we really try to emphasize a lot of. It's like accessing your own information so that you can be a power of your own body and you can know exactly how, this system works for you, not just what they tell you.
Thank you so much for that response. And I really like how you incorporated like your experience as a doula and how that's all about accessing your own information. I'm curious also, like when you say having like shared information, Dr. Mosca mentioned how like some dentists or other providers aren't aware of like the updated protocols. So, what is a myth or misconception about oral health during pregnancy and postpartum that you wish more people understood? Like, what is that piece of information that would be so helpful if everyone just like had a clear understanding of it?
What I say so much is that pregnancy is not a medical emergency. It is a normal physiological cause of life. And so if we get that through, our heads and we understood that is natural and that there are things that precede, that happen during the pregnancy, as we talk about gum bleeding, there are warning signs that we see, right? And that we can address. But pregnancy is just everybody does it. Birds, everybody, like literally everybody gets pregnant, right? So, but in reality, like routine oral health care is important during pregnancy and the postpartum period. And if care is delayed in those ways, we're missing things. There it allows for small problems to become big ones. And if we're really in the whole body care and we really care about the health of our parents, we were equipped them with the information very early, right? And so another misconception is that like gum, and Dr. Mosca already brought this up. Gum bleeding or teeth pain is just a normal part of pregnancy. We hear that all the time. Our patients are like, "Oh, they told me that it just happens normally." I was told that as well. But that is a signal, that is a sign, that is a symptom worth paying attention to. And so the more that we normalize oral health as part of prenatal and postnatal care and postpartum care, the more likely people are able to get what they need very early in their pregnancy.
Thank you. Okay, I would love to get your perspective. So, the maternal health field has had a large focus on hyper disorders of pregnancy and cardiovascular health, as you are aware.
Yeah.
So, where does oral health fit into this conversation? Does the connection between oral health and cardiovascular disease give us another compelling reason to prioritize oral health care during pregnancy? And where do you see like maternal health and oral health finding this connection?
Right. We know that there's a strong connection between oral health and cardiovascular disease, right? And so, but I do think that oral health fits very naturally into the broader maternal health conversation. When we talk about hyperemesis, when we're talking about dryness of your mouth, literally when we talk about lactation, we're talking about your mouth. We're talking about well, we're talking about the baby's mouth, but we're also talking about what goes in your mouth. And we during pregnancy, we're also talking about how to feed your body from the inside out. And where do you do that? Through your mouth. So I think that it has to be brought into a broader conversation in maternal health. But once we are already focused on, like, once we are really focused on hypertension disorder and cardiovascular disease, or cardiovascular health, more or less, oral health becomes another important piece of the puzzle. Like, you can see it going together because your mouth is connected to your whole body, just like I just said. Like, it's just connected. Uh, I think that the disconnect comes when that fear of, like, oh, I don't know what to do. I see it so many times, or I saw in the chat where like doctors are literally telling them that like your oral health can be last, which is wild. It's very wild. But the connection gives us another reason to prioritize our oral health care during pregnancy and not just keep it separate or something as a separate thing. So I think overall, it will help us reduce the risk in our whole body or whole person care when we really support our oral health and we support prevention and early intervention, and be more integrated into the model of maternal health care. So yes, I think that there's a strong case for oral health routines being added into the pregnancy care, even so much so, and I'm sure we'll get to that later, but um, I'm thinking about questions that we will add on our intake for our own doulas, and even having those questions early, because a lot of the information comes. The way our practice works is we do an intake and we get all this demographic information, and then our doulas go in to have a more in-depth conversation. But how can we make sure that our doulas are actually talking about those things? Like, do you have hyperemesis? Is your mouth dry? Do you brush your teeth, at least once a day? I think yeah, I've been really thinking about how to add that to our own practice. So, yeah, more good things to come.
Okay, that perfectly leads into our last question. So you said adding intake questions and you're thinking about other ways to integrate it into your doula practice and at Birthmark. So for other maternal care providers on this call, what are some simple, actionable ways that they can begin to integrate oral health into their work?
Yeah, I think Dr. Mosca also highlighted this, but for our maternal health providers, one simple place to start is like a few basic oral health questions, right? During your prenatal and postnatal visits. You can, yeah, it doesn't have to be, you don't have to be a dental expert to ask questions. You just have to be someone that cares about whole body care, right? And we know that our mouth is connected to our whole body, and have it can be a simple step in your entire maternal health process. I would say I think about even as a mental health provider. I mean, we talk about a lot of different disorders, and I'm like, mouth comes up a lot. We have pica, you have people who have, anorexia or belief, like that, your mouth comes up. So I think that we should be having this conversation in every sector. Our providers also feel they're able to feel supported as well. And we use our dentists a lot with tongue ties. So building that referral system is another way that you can stay connected in this, as a provider to the oral health. Having a trusted referral list, understanding the community clinics, looking for low cost resources for our clients. So small changes like screenings, education, referral support can make oral health routines as a part of our maternal health care. And I'm saying that Birthmark, we're going to do it. We're doing it. We're going to do it for sure, for sure.
Thank you so much, Dr. Williams. I definitely love this conversation. And I will remember your statement that pregnancy is not a medical emergency. That I'm gonna take that and use it. It's amazing.
Absolutely. Absolutely.
Um, and now going to pass it to Steph to lead us in our Q&A section. So, Steph, you can take us away.
Yeah, so thank you to Dr. Mosca and Nick, and then Mignon and Dr. Williams. Both of those conversations were really engaging, insightful, a lot of engagement in the chat. So I'm going to go through and see if we have any questions or if there was anything that was highlighted. Feel free to drop your questions in the chat or use the Q&A function. But I did see a couple. Let me just scroll back up. So I think this was to Dr. Mosca's point earlier about postponing dental care or that it's not a priority from other care providers. So I believe as Yvonne said, yes, that's what's happening. The OBGYNs are suggesting that any dental care should be held off until after delivery. And then also to Dr. Williams' point, again, pregnancy is not a medical emergency, so that is not necessarily what we should be recommending. But I'll allow Dr. Moscow or Dr. Williams to provide any additional context or feedback to that point.
Well, I think that that speaks to the need to make sure that we're educating the obstetrical community and maybe also from a systems perspective, learn a little bit more about some of the risks that they see. Again, to the point that maybe there are still some people who think that any outcome that's not a desirable outcome could be related to things that are more myth than fact. So I think that we should, I mean, because we've had the same type of issues come up in other areas of health recently, where people have this misconception that such and such causes such and such, So
Mhm.
I think making sure that everybody's clear on guidelines. The guidelines are not just dental guidelines, they're actually supported by the obstetrical organizations as well.
Mhm. Yeah.
Dr. Williams?
I think that, we try to make sure that our clients, that's why we, have this form of advocacy and power around your own information and being able to research and figure it out and have an advocate like a doula, or a community health worker, a perinatal community health worker, someone that can help you kind of like find that stat, right? And take that back to your doctor, maybe. Sometimes you have to show them. We're in a space where CDC, all this information is not available or readily available as we would hope. So I think that there's an opportunity here to not only just have our our advocates educate, but also our clients educate themselves as well. So that is very unfortunate. We see this in the behavioral health sector too. It's like, don't take your medication as soon as you get pregnant. It's like, no,
Mhm.
you can't do that. You can't just like
Mhm.
abruptly stop a med that you've been on for years for some people. So just taking that rationale and placing it in every sector would be amazing.
And I know there's a
Yeah.
commission, there's a commission on a state commission on perinatal care and infant mortality. I can't remember the name of it. But, I mean, I think this is a question to pose to them too. How best can we make sure that all providers are aligned on the current recommendation and guidelines?
Thank you both for that. And Dr. Maska, you got a lot of feedback or engagement around your ARC recommendations.
Oh,
So
okay.
someone asked if we would share that or if we could share it again. I'm not sure if you could briefly go through it again without all of the details, but I will say for the audience, we can document that and write that down and share that out in a follow-up. But Dr. Maska, do you want to briefly just share what ARC means again?
Yes, and I'll put it in the chat quite simply. It's ask, reassure, and connect. So keep it simple. The ask, to Dr. Williams' point, come up with the one or two screening questions that can be asked in all health settings. Uh, Reassure the patient that you can have dental care if you have any problems, or you should have an evaluation. It's a PRAMS measure. So let's push the evaluation, but any care that is needed can be rendered and received. And then the connect, help the patient. Don't just say you need to go to a dentist. I'm a big advocate of let's organize our communities. Let's engage our community health workers and others. Let's make sure everybody's aware of what the opportunities are to connect people that provide these services. Let's do the kumbaya, let's make sure that we're all working collaboratively.
Thanks for that, Dr. Mosca. And we do have a couple of questions from Jasmine Alexander, and I think this will be good for Dr. Williams. So, do doulas currently receive education regarding maternal oral health? What educational resources would help doulas incorporate oral health into prenatal education, and how can doulas strengthen referrals to dental providers? And I will say before I turn it over to Dr. Williams, um, after we're done with Q&A, I am going to turn it over to my colleague Ann Jace, who's going to talk about an opportunity for engagement with doulas, maternal care providers, and oral health care providers. But I'll turn it over to Dr. Williams to see if she has any insight that she wants to share.
I was just gonna mention that I'm like, this is not a new phenomenon, but it is very new to our communities. And so I'm happy that LPHI is always stepping to the plate to educate the community on this. So you'll see more education, even from Birthmark. We do grand rounds, and our education coordinator, Jamila Webb, was just saying, yes, let's do another segment on this. And I'm sure you'll see more and more from our the steering committee members pop up of more information that is happening. I will say that in many doula trainings, it's probably talked about when we talk about the correlation between cardiovascular disease and the risk of hypertensive episodes, but I'm not really sure if everybody is getting the same knowledge around it. But I know that this space is evidence based, and you're getting that information here. Um, yeah, so yeah, we're happy to like throw some links. Thank you, Dr. Mosca, for throwing in that curriculum. There is out there. The information is out there. Yeah.
And they do have one specific to pregnancy care.
Mm-hmm.
So,
All right, so I'm gonna wrap up our conversation. This is really engaging, and I feel like we could go longer, but unfortunately, we only have an hour, and I do want to give, again, my colleague an opportunity to share more about engagement opportunities for both our oral health and maternal health care providers and practitioners. But just one more time, thank you so much, Dr. Mosca. Thank you, Dr. Williams, Mignon, and Nick, for those engaging conversations. Again, this session will be recorded, so if there's anything you need to reference, you can always go back to the recording and we'll send out a follow-up. But with that, I'll turn it over to my colleague, Ann Jays. And again, she's going to talk about some engagement opportunities for both doulas, maternal care providers, OBGYNs, and others who support pregnant and postpartum people and babies in Louisiana.
Thanks so much, Stephanie, and thank you to all of our speakers. What a phenomenal session. I feel like I learned a ton, and the group really emphasized the need for this work that we're embarking on. So let me share with you what we're doing on our Maternal Oral Health Exchange COP. So this exchange is created to address many of the issues that we talked about today. We will unite community-based maternal care providers, OB-GYNs, pediatricians, dental care teams, and grassroots organizations in a shared mission to improve oral health outcomes for pregnant women and young children. So we're working on it, and there's space for you to be a part of it. It will be a dynamic platform for continuous education, peer learning, and coordinated advocacy to drive sustainable change. Many of the suggested solutions that we heard from Dr. Williams and Dr. Mosca involve these policy objectives. And so so there is some real space to do some work and roll up our sleeves and see what we can get done on this. So we've got these two big buckets. It's this education piece and the policy and advocacy piece. On the education side, also working on some of these issues that have been raised, training community and clinical providers on, and again, you'll see water fluoridation throughout this. I do want to highlight that there is a moment of some hot topics around oral health care in our state legislature and across the country. We've seen this come up in the Louisiana state legislature and a lot of questions around the safety and efficacy of water fluoridation. And so we want to continue to build off of the body of science that exists on this topic and use it as a way to continue to improve oral health outcomes during pregnancy and early childhood. And so we've got that education side, including water fluoridation, and appropriate healthcare for oral healthcare for pregnant patients. So on the policy and advocacy side, we do want to mobilize support and around fluoridation and some of these coverage issues that you heard Dr. Mosca and Dr. Williams talk about. So that's what we're going to be working on together. And this is our steering committee. We've already had a phenomenal steering committee meeting, just powerhouse after powerhouse as part of this group, and really have had phenomenal discussions. So this is the group of the people who will be leading the thought leadership behind the work. Really grateful to have such a team of just experts to work on this together. And then finally, this is where you come in. We are having 4 sessions. This is the first one, so you're already part of the crew. And this is the QR code where if you're interested in really joining the effort, you can. We've already had about 40 people sign up. And so really just wanting to get as many people as possible to join in these efforts. I really loved, Dr. Mosca, what you said, not just passing patients from silo to silo. And so I think the more people who are involved in this work, the more interconnected we can build our efforts. And then that's it for me. Hope you all can join us, and I'll pass it back to you, Stephanie.
Thank you, Anne. And again, thanks to everyone who's already joined our community of practice or the Maternal Oral Health Exchange. So just a point of clarity for folks. So this kickoff session is also doubling as today's grand round. So some of you may have been registered for grand rounds, but not necessarily for the Maternal Oral Health Exchange. So if you are interested in continuing the conversation around maternal and oral health and the intersections and how we can improve integration, then please use this QR code, or Mignon also linked the application in the chat to continue the conversation and join our cohort of participants. So thank you all so much. And I think we just have one more slide. And as always, please complete the evaluation. Let us know how we did. Let us know how we can improve. Again, your evaluations are important because it helps us curate future grand round sessions, and in this case, future community of practice sessions for people who join the exchange. I want to note that our next session is going to be Thursday, September 24th at 10 a.m. We are taking August off, so we'll see you in a couple of months. And if you have any questions about community health grand rounds or the exchange, you can either contact me or Tiffany, one of our other coordinators on our team. So thank you all so much. I know there are a couple of other questions coming through in the chat, but we will respond to those via email after the session. So thank you all so much. We appreciate the engagement. And thanks again to our speakers and our facilitators, Mignon, Nick, Dr. Mosca, Dr. Williams. You all were amazing. And thank you all for attending. Have a great day.